Good morning. We're here in the Premium Care Medical Suites with our first patient today. He's one of our foundation patients with Premium Care Kids. So he's 1 year old. He's born with a cleft palate, and his mom found us and brought him for repair. So all of these cases are done absolutely free of charge to the patients, and it's a pleasure to help these families. Okay, so he's got a cleft of what's called his soft palate, which is the posterior part of his palate, and the anterior part's actually intact. So what I've done is I've made some incisions along the cleft margin and then laterally. And what we've got to do with this is, number one, we've got to close the hole here so that he can speak and eat normally, but also to speak normally, there are muscles that live in the palate that we've got to reconstruct so that those will function. So I've actually done the first part of the dissection to get things sort of mobilized, and then we're working in this tiny little hole with these surgeries, and 1-year-old child, so they're quite delicate. But now we'll begin the reconstruction of the palate. And the way we do that, there's actually 3 layers. There's something called the nasal mucosa, which is what I'm sewing now, and that's the layer that faces up into the nasal cavity. And then there's going to be a muscular layer, and then there's the oral layer, the layer that faces into the mouth. So cleft palate teaching is an experience, shows that we've got to do a nice 3-layer repair and also a beautiful muscle reconstruction to get everything anatomic and functional. If we do this all correctly, this problem will be a thing of the past, and we can normalize his anatomy, and then with normal development and some speech therapy, there can be no evidence that he really had this cleft.
Why did I stay? I should be leaving. Hear what I say without even speaking. My compass is off, why did I choose you? I'm just too lost, I need to cut loose.
Okay, so things are going very well. We're about 1 hour and 15 minutes into surgery. We've got everything dissected, our nasal layer is closed, we've got our muscular layer identified and fully dissected. That's been retropositioned, we call this in palate surgery, to put it back in an anatomic position so it functions well to oppose the palate to the posterior pharynx, and so that's perfect. And now we're going to close the mucosa here as the final layer. So everything moving along quite nicely. We need an anatomical tension-free repair for best results here.
Let go and let me love, let go and let me love again. Let go and let me love, let go and let me love again. Wanna let go, I wanna lose you. Fall out of love as you're supposed to.
Okay, so we're all finished. It took about 1 hour and 20 minutes, so it was very smooth. You can see we've now got a closed palate. I showed you he's got the muscle that's functional inside, and these will be, invisible really once they're healed. So he'll wake up and go to the recovery room, and we're excited for him and his family. Great case.
Let me love again.